Side effects of steroids use. The side effects that steroids have on the body are many and can cause some serious side effects including cancers, but many sports users chose to ignore any information on side effects, even to the point of using the excuse of it's only the drug's abuse that causes side effects, but any drug that alters the homeostasis of the body will have an effect. Brain. Studies have shown a pattern between high testosterone levels and aggressive behavior, which is often seen as the users involved in violent acts. Often steroids have been used as an excuse for a person's aggressive behavior. High-dose users have also been affected with psychotic syndromes and a high level of anxiety. Face. Steroid use results in high levels of water retention, edema, leading to the user becoming round-faced with puffy cheeks. In females, reports have shown the effect of a growth of facial hair quite common. Bad breath is quite a common effect, as is the voice of females becoming husky by a deepening of the voice. Steroids also commonly affect the skin of the face and body by causing acne. Eyes. Long-term use of steroids can actually damage the eyes, resulting in eye infections, cataracts or glaucoma. Hair. Male pattern baldness is common in both females and males due to the conversion of high levels of testosterone into dihydrotestosterone or DHT, causing the hair follicles to shrink, which only then produces very fine hair. Eventually, with continued steroid use, the hair follicle dies, leading to permanent baldness. Heart. This section the steroid user should be most concerned about, but normally choose to ignore until a serious cardiovascular event happens. Steroid use causes heart disease and becomes evident due to high increases in total cholesterol levels, causing a buildup of cholesterol on the walls of the blood vessels, which can also lead to strokes. Also shown is a decrease in the levels of the good cholesterol, HDL, and increase in the bad cholesterol, LDL. Blood pressure is known to increase and blood clots in blood vessels, disrupting the blood flow, causing damage to the heart muscle, leading to heart attacks. Stomach. Normal signs of problems to the stomach from steroid use include feelings of being bloated, a feeling of being nauseous leading to bouts of vomiting, with blood sometimes being evident in the vomit caused by irritation to the stomach lining, and increased stomach acids with a lower level of stomach mucus. Kidneys. The kidneys are important for the elimination of waste material from the blood and the regulation of salt and water levels. Another important function of the kidneys is the regulation of blood pressure. High blood pressure damages the blood vessels and filtering system of the kidneys. The occurrence of kidney problems occurs mostly with the use of oral steroids, with a suppression of blood clotting factors, leading to increased blood clotting time following cuts or injury. The kidneys have to work harder with oral steroid use due to increased requirements to filter the blood. Steroid users also normally resort to ultra-high protein intake, sometimes far in excess of normal intake, involved with weight training, which can lead to kidney stones. Kidney stones can block the opening of the urinary tract, leading to problems with urinary excretion. High blood pressure can also cause problems to the kidneys by damaging the blood vessels by causing thickening and narrowed blood vessels, leading to a reduced blood supply and filtration. Liver. The liver, the largest organ of the body, is used to filter harmful toxins from the blood and for storage of certain nutrients like vitamins, minerals. It is also important for the managing levels of chemicals such as proteins, cholesterol and sugars. The liver is also used for the production of bile to aid in the digestion of food. Steroid use has been shown to cause irreversible liver damage and cancers. Oral steroids are difficult for the liver to metabolize, leading to a decrease in the ability of the liver to clear waste products. Some counterfeit steroids have been known to carry all kinds of bacteria and virus, leading to adverse liver function. Hepatocellular jaundice, which is evident by a yellowing of the skin and eyes, can be caused by an abnormal liver function as the liver cannot effectively filter the blood. Chest. Breast development. Gynecomastia from steroid use is a very common and an often seen side effect of long-term steroid cycles or high-dose steroid use, causes a formation of breast tissue which begins as visible lumps under the nipples that normally requires surgical intervention. The breasts of female steroid users can actually shrink in size. Bones. Use of steroids by teenagers and males in their early 20s who have not yet ceased growing can impair bone growth, leading to being shorter in height in adulthood due to premature closure of epiphyseal growth plates. Bone pain can also be a side effect of steroid use. Skin. Steroid use can have an effect on the user's skin by affecting the skin pores and causing roughness in the skin texture. Other skin conditions that are often seen are red blotchy, greasy skin with acne on the face and back. Prostrate gland. The prostrate gland is specific to males and located just below the bladder. Its main functions are the production of prostatic fluid, a component of seminal fluid, and are also for maintaining sperm activity. Steroids are known to cause an enlargement of the prostrate gland, and as the prostrate gland encircles the urethra, any swelling of the prostate can cause interference in the urine flow. Males should be made aware that any changes in the prostrate gland can also affect sexual activity. Other effects that can happen are abnormal sperm and a decreased sperm count. Blood poisoning. Many steroid users are often frightened to go to a needle exchange to obtain a supply of sterile needles in case they are labeled addicts, often resulting in the use of, or sharing of non-sterile needles, which can cause blood poisoning with a higher risk of infection and infectious diseases. The user's injection site can also become swollen and tender and can lead to abscesses, which can then lead to the requirement of painful medical intervention. Impotence. Taking steroids will cause the testes to decrease its normal function. When stopping the testosterone supplementation, it takes a while for the pituitary gland to signal the testes to once again begin manufacturing testosterone. In long-term or high-dose testosterone use, the testes can actually cease production or can actually atrophy, which can lead to a long delay in the testes beginning manufacturing testosterone naturally. Impotence occurs after the steroids cessation, and long-term drug use causes lack of erections.